Welcome to my channel OSCE with Vimal. Today I am going to talk to you about CBT examination. There are a lot of students outside Kerala is looking for CBT examination to be explained in English. So there was a lot of requests that has come up from the other side of the state, especially from northern India and outside Kerala and outside India, and they need some explanation in English. So this video is for themselves. Okay, so today's video I am going to talk to you about CBT, and I am going to run down the whole scenario of CBT. What are the nutshell inside the CBT, how you can crack down CBT. Okay, so now we will start. CBT is basically a computer based examination that is conducted by UK NMC. UK NMC does not have exam centers there. It's given to two test centers, either Alpha Plus or PSNView. Most of the Asian countries, PSNView is conducting the examination, and from the PSNView, you have to go for the PSNView site itself in order to get booked for CBT. Okay, so that's about a CBT examination. The other point of the CBT is once you finish the CBT, you have two more chances. There is two parts will be there, that is part A and part B, and you have to get a pass for part A and part B separately. Okay, and once if you are not getting pass for any of the parts, you have two more attempts will be there, that is second time and the third time. Thereafter you have to start the whole process from the beginning, and you have to wait for another 6 months. That's the other side of the CBT examination. And now I am going to talk to you about CBT, the part A and part B. So I told you it's divided into two types, so two levels, that's called part A and part B. Part A is called Numericals. Numericals means a nursing calculation. It's a very simple calculation, and the students who are working or who are studying in the UK, and once they finished and they are going to enter in the stream as a bedside nurse, their experience is being assessed in the CBT examination and OSCE examination, because they are not going to ask you about too much or about advanced things or stuff like that. No, they are going to ask you very basic things. So numeracy, coming back to the numeracy. Numeracy is you have a 30 minutes examination, numeracy is having, and you have 15 questions, and out of the 15 questions you have to get 13 pass. Then only you will get pass. So 13 should be in success in order to get the pass. So that's about 90%. The other side of the story is it's not a multiple choice examination, so you have to find out your answer. There is a calculator will be provided on the onboard calculator, that is the screen. There is a calculator will be provided. Based upon the calculator, you can use the calculator with the mouse click, and they will give you an orientation before the examination itself. So you can use the calculator and do the calculations and enter into the column or dash that is provided over the question there. Once you have entered inside, then you can click enter, then that's it. Then the difficulty is the spacing, as well as there can be some difference, like capital letters, small letters, decimal points. So all these things are matters. So for decimal points you have to add 0 over there, and also you should not put any extra spacing between the numbers. And if there is no unit given, your job is to give a unit. And case of when you are going to write ML, so you have to write M small and L capital. Okay, not to get an idea about how you are going to enter your answer in the PSNView platform. There is a PSNView platform, there is a practice platform that's available free of cost. You can look for that, and you can enter into that PSNView platform and study yourself how you can figure out these things by yourself. Okay. The other side is there are certain times in which the onboard calculator is not working, in which you yourself will be given a pen and paper, or an erasable board and a marker will be given. So you have to calculate by yourself. So this is a bit tricky, but from my 2 years experience, I haven't got any feedback on this side, because it's working perfectly so far. The calculator is okay, so you can use the calculator over there. And the pass percentage is 90%. That means out of 15 you have to get 13, then only you will get pass. So that's about the numericals. Once you reach over UK, if you are going for IV therapy course, if you are going to work with IV cannulas, if you are going to work with IV infusion pump, syringe drivers, then that type of pain medication pumps, then PCP pumps and stuff like that, In that case, you have to get a license, and this is the similar examination you have to undergo over there once you reach over there. So this numericals will be an experience or an added experience, a double plus once you reach over there if you are looking for the IV therapy course over there. So that's about the numeracy examination. So you have to get separate pass for that, okay. And the type of questions you are going to get about the numeracy, I have to tell you about a brief on that side. So the first type you are going to get is a conversion question. So that means you have to convert from one question to another, milligram to gram, gram to milligram, or ml to liter, liter to ml, and stuff like that, okay. And the second type of question you are going to get is measuring the correct dose. That means there is a medicine will be given, a liquid medicine will be given in a medicine cup or oral syringe. So you have to figure out how much is inside, and based upon that you have to enter in the column. There is no calculation required. There is no, it's mere common sense. You just look at there and put your number over there, you will get pass, okay. That type of examination or that type of question you are going to get is oral medicine calculation, in which your oral medicine prescribed dose will be given and the available dose will be given. Its dilution will be given, and based upon that you have to calculate the available, that's the how much ml has to be given. Likewise, the injection medicine also you have to do the same way. Then there is an infusion calculation in which a time calculation will be there, and a rate calculation will be there, and a drop rate calculation will be there. And the other side is there is a pediatric calculation in which you have a pediatric body weight calculation, body surface area calculation, and an intake output calculation. So these are the different calculations you are going to get in the numeracy examination. You will get 1 or 2 questions on each side, and that will come up to 15 questions. That's the total over there. So once you finished the numeracy, you have clinicals over there. There is no need for going numeracy first or clinical first. Whichever you want to attend, you can attend. There is no problem over there. Now I am going to talk to you about the clinicals. In clinical examination, the point you have to keep in mind is you have 100 questions in clinical examination. And among the 100 questions, you have to get, there will be another problem with the clinicals is, usually when we are going for clinical examination, something like there are so many nursing examination will be there, hard, prometric, then RN examination. So all these examinations, they are going to test your ability in the clinical area. Something like your disease condition, diagnosis, nursing management, treatment plan, then all these stuff are being tested. But in case of UK CBT clinical examination, they are not going to ask any of these things. They are going to ask you about the 5 domains. 5 domains means basically they are the code, the rules, regulations, practice, ethics, that's over there. So many, for example, lone worker policy or whistleblowing policy, Mental Health Act, Mental Capacity Act, Court of Protection, then the code of conduct. So all these are the rules, laws, or deprivation of liberty of safeguards. So these are the rules or Johari window. So these are the rules, norms and regulations they are going to ask you. That will be coming around 80-85% of questions. So you have to prepare yourself in a good way with some experienced educator or trainer who have experience in UK. Then only you can pass. The other side of the story is, if you are working as a care assistant or a nurse over there, you don't have any experience on this side because you are mere on the lower side of the hierarchy. You don't know, you don't have to work with any of the policies over there. But if you are working as a senior manager there, then only you are going to work with these policies over there. Okay. So 80-85% of the questions are basically coming from the 5 domains. In which there are 5 domains are basically the professional values, communication skills, then leadership and strategies, then the professional values, infection control policies, then adult nursing policies, and all these things are the part of professional values that's going to come, the 5 domains that's going to come over there. And the rest of the 15 questions will be divided into 1 or 2 questions from the research side, 1 or 2 questions from the nursing theories, and very few questions from the pediatric, adult, and stuff like that. So 1 or 2 questions from the other areas as well. The pass percentage will be coming as around 60-65%. There is no pass percentage like that. So after the examination, a board will decide how much will be the pass percentage. Based upon that, the pass percentage is decided. Okay, so that's the other side of the story about the clinical examination. And you will have 2.5 hours, and you will be getting 100 questions. And most of the students are find it difficulty to pass a clinical examination because they are going to ask you about the norms, rules, and regulations. I have seen many of my students who is coming for training along with myself. they are talking to me, they are okay with nursing, and they did a lot of examinations. So this is a peculiar examination, and they are not going to ask you anything about nursing or nursing management or disease condition or diagnosis. Yes, that is the story with the CBT. So if you are well versed with their rules and norms and regulations, then only you can pass the examination. Otherwise you are going to fail the examination. So better go for a good training for that. Okay, so the story is the 2.5 hours, then the 60-65% will be pass rate, and the other one is some 80% of questions will be 80-85% questions will be based on 5 domains I told you, and the last of the 10-15 questions will be about distributed all across pediatrics, adult, maternity, and stuff like that. Then these are the important points you have to keep in mind as per our CBT examination. I presume you got a basic idea about CBT examination. Once you finish the CBT examination, then you can sorry for that, then you can go for UK, and once you reach over there, you are going for a OSCE examination. The examiners will give you direction on that side, that I will going to discuss in another video. So hopefully you got an idea about what is a CBT examination, and any of you are looking for a CBT examination, because myself is doing CBT training for 2.5 hours. I have an exclusive English batch exclusively for outside Keralites and outside Indians. So I have it, and if you are looking for training, or if you are looking for support, I am ready to support you. This is a 1 hour training, and I have some 15 hours of training will be given for a CBT examination. If anybody is looking for CBT training, please come back to me, and I can guide you, because I myself was a nurse and nurse manager in the UK system for nearly 70 years. That's 17 years is such a long time in which myself was implementing, or I am an implementation officer of these rules and regulations and the norms and the practice and the code and stuff like that. Okay, so I can help you in a good way. Okay, so if you are happy, if you are looking for any training, come back to me. I will give my contact number over there. I have an exclusive English batch for yourself if you are looking for training. So thank you very much for listening to my video. I will come back with another wonderful video, and if you are interested in the video, please subscribe and like, and also you can press down a bell button, so that I'm uploading a sequential of videos in order to give you some basic understanding of CBT, so as well as OSCE in the coming videos. Okay, so you will get a notification for that. So thank you very much for listening to me, and I will come back with another wonderful video in the coming